Infertility is devastating. It's absolutely devastating. Not only because your hopes and dreams of having the family that you have wished and wanted for is not happening, but also because of the many emotions that you might have yourself or that other people are placing on you. As a family doctor who's had many patients over the years who have been struggling with infertility, I can tell you, as someone who's been with my patients on their journey step by step, right, that so many emotions can come along with this. Many of my patients have often felt shame. They felt embarrassment. They felt less than a woman, less than a man. They've felt isolated, like they didn't belong anywhere. And so many other emotions that we're going to talk about. But not only that, many of my patients over the years have felt feelings from the world, their community, judgment that they don't have children, blame, stigma, and so much more that really has just made it all worse, has made a situation that is already hard enough so much worse. Now, as a family doctor, I'm not a reproductive endocrinologist or specialist or GYN, but again, I'm with my patients who are seeing their specialists in their quest to have children. One thing I want to start out by saying in this video is that if this is you, number one, I'm so sorry. This is tough. This is very tough. And if that's how you feel, you're right on. And the second thing I want to say is that you don't deserve this. You don't. There are many things that must happen for conception or conceiving a child to occur. Our brain has got to produce the right hormones and chemicals to allow a woman to have proper ovarian function. An egg has got to mature in the ovaries, and then the ovaries have to release the egg. Fallopian tubes have to pick up that egg. Sperm has to travel through the uterus to the fallopian tube and must fertilize the egg to create an embryo. The embryo then has to travel to the uterus to be implanted. And even more than that, pregnancy can't and doesn't occur if those things and so many more things don't happen. That, by the way, is a courtesy of Cleveland Clinic. I like the way they discussed it. When we talk about infertility, experts recommend an infertility evaluation if you've not gotten pregnant after 1 year of having regular sexual intercourse without using birth control. If you're older than 35, an evaluation is recommended after 6 months of trying. And you're probably wondering, why is this even happening? Why am I going through this? Well, first of all, let me say, sometimes we don't figure out the answer, which I know has got to make this even harder. But that honestly is the truth. The most common cause of female infertility include problems with ovulation. The most common cause of male infertility include problems with sperm cells and how they function. But there are many, many other factors that can and do affect fertility, including age and your lifestyle, your health conditions, your underlying medical conditions, so many different things. This is the thing. What's most important for me in this video is that you find the space, the place, the people, the environment that supports you through your journey. Infertility, as I mentioned, is so tough, but I probably don't have to tell you that. I know that you already know if you're watching this video. What I would encourage you to do is to support yourself with things that are going to support you during this process. You and your family, your partner, yourself. Obviously, we want to start with medical specialties and specialists that can help you. Your GYN, your reproductive endocrinologist, your urologist for men and sometimes women, and your other medical specialists. But also don't forget your mental health. We're talking about how you're feeling during this process. Remember what I talked about in the beginning. It's not just shame and stigma, but there's also feelings of secrecy. Do you tell? Do you not tell? When you tell, what do you say? Maybe even more importantly, what is it that other people say? And oftentimes what other people say can be so harmful and hurtful when they mean well. But it can be so hard because people don't always know what to say, right? There's also the anxiety and depression and mood swings and changes that comes with the process of infertility or the process of trying to have a baby, whether you're going through fertility treatments or what have you. Let's not act like that doesn't take a toll or may not take a toll on your mental health. There are a lot of misconceptions. There's a lot of judgment. There's a lot of unfortunate cultural stigmas and feelings that, women are associated with fertility and must be. And if you're not, then there's a problem with you. You know what I'm talking about, because there are many cultures and places around the world that have these sort of ideas and can make it a lot worse. I think it's really important to realize that infertility is not a character flaw. It's not a flaw in who you are as a person. It's not a flaw at all. It's a medical condition. Just like medical conditions that happen when people have asthma, allergies, cancer, cholesterol, diabetes. This is a condition that tends to be more emotionally involved for good reason. Don't get me wrong. But infertility is not a character flaw. There's nothing wrong with you. You're going through a medical condition in which you may need support and help with. And I'll also say, please seek out a therapist, a counselor. Stick with the people that are good for you. Figure out the best way for you to operate within the space that you're in. Maybe you need to avoid certain environments. That's okay, by the way, if you feel that way. Don't want to go to certain events? Fine. Okay? Do what's right for you. Take care of yourself as you are going through this process. And I say this not with pity. I say this to hopefully let you know that I'm going to say what I said in the beginning again. I'm sorry you're going through this. And also, you don't deserve this. And also, this is not a character flaw. You have a medical condition. So as much as I know that these words are not going to change this experience for you, it's not going to change your infertility or fertility issues, I hope that it gives you some solace and comfort knowing that you have every right to feel the way that you do, and know that this journey is tough. And if you feel that way, you're right on. That's how it is. Seek out specialists that will help you, people that are good for you, therapists, and whatever you need. And hang in there. I'm Dr. Jen Caudle. I'm a practicing family physician. I'm an on-air health expert and video creator. I do daily videos. I'm on Facebook. I'm also here on YouTube. Please subscribe to my channel. Click the little bell for updates. Please like my page on Facebook as well. I'm on Instagram and TikTok and so much else as well. I'm Dr. Jen. Sign up for my free health newsletter at drjencaudle.com. I'll talk to you soon.